Hi, I'm Mindy Dunkel. This is my assessment for the nursing class. I'm going to be assessing my knees. Okay, Ellie, come on up on the scale. We're going to go ahead and get the rest of your height. All right, you're 118 and you're 5'4".
So what is your physical for?
Cheerleading.
For cheerleading? Okay. She's 5'4". She's 118 pounds. She's active in sports. Her height and weight is relational to her age, is 18, and her lifestyle, and she appears pretty healthy. She has a normal gait. It's even, it's upright. She's not using any assistive devices, no involuntary movements. She appears to have a good range of motion. I did watch her walk from the bed to the scale and then back. She seems like she's in a good mood. She's friendly. She's appropriate. She can answer questions. She's articulate. She speaks English. Her thoughts are organized. She's able to speak in complete sentences, and her hygiene seems to be good. She doesn't have a smell to her. She's nicely dressed. I'm going to be assessing your skin now, and I'm going to go ahead and touch your face. Is that okay? I'm going to touch your forehead. Now I want to know if there's any pain or tenderness in anywhere I'm touching. Okay. Any spots feel hot or cold?
No.
Okay. I need you to take your hands off. Okay. Can I have you stand up for me? I'll look at your skin. Can I lift your hair?
Yeah.
Okay. I'm looking at your. Okay. And I'm not going to take off her shirt for this, but I would be taking, and normally she would be in a gown, and I'm not having her dress completely. Okay. All right, you can go ahead and have a seat. As I'm assessing her skin, I want to do anterior, posterior, and lateral, which we did. I want to make sure that her skin, when I'm touching it, is even temperature, which it is. Her feet are a little cold, and her hands are a little cold, but the rest of her body is good. There's no moisture at all. There is a small scar on her right leg, and she does have some scratches on her left anterior thigh. She seems to have pretty good skin tone, and I'm going to just do a little pinch here, like near your clavicle. She does not have any dehydration. There's no Turner noted. Ensure that there's no rashes, lesions there. The other thing about the hands and the feet we want to look at, I do want to double check her nail beds to make sure that they're pink, that there's no clubbing, that there's no clubbing, there's no webbing in between her fingers. Also, I want to look at the bottom of her feet. And her bottom of her feet look good. There's no sores, and especially if they're diabetic, which she's not, we definitely want to check the bottom of her feet as well. So Ellie, I am going to have you take off your glasses, and we are going to look at your face. Can you take a look at me? All right, so looking at me, I see her eyes is symmetrical in her face, her mouth, her nose, her ears are all symmetrical. I already touched her face earlier, but I'm just going to double check and see her skin. I'm going to check behind her ears and see her nasal folds are present, and look up here. Okay. Now the other thing I need to do with her face is that I want to make sure her shape and symmetry is good, and it is a pretty face, I must say, for my niece. The thing that we're going to do is check her hair, where we're up here in the skull area. So I am going to use a tongue depressor to look through her hair. So I'm going to take half-inch sections, and I'm going to just kind of start looking for any type of infestation. Now normally I would do both sides of the head, but since this is going to be a short video and we have a lot to assess, I am not going to do her whole entire head. And, this is going to go in your ear. In order to save time, we went ahead and checked this to make sure it fits into her ear prior to inserting it, and it is a 2.7. We're going to go ahead and take a look, and like I said, there is no redness, there's no swelling, there is no drainage, there's no tenderness, there's no odor. We're going to pull her ear up, back, and out a little bit to straighten the ear canal. Okay, and now Ellie, I'm just going to have you kind of tilt your head a little bit this direction, And I'm gonna go ahead and pull your ear. And I can see her tympanic membrane. It is concave. Earwax, I don't see any drainage. Don't see any, it's concave, it's semi-transparent. Painful at all?
No.
No. You hold this for me. We're gonna get another 2.7. Up and out. And it's the same for this ear. When we are doing the assessment in the ear, we're also supposed to see if there's movement in the tympanic membrane. I know that you're supposed to put a little bit of pressure on it to see how, I'm not really comfortable doing that. I'm not allowed to do that here. So I do want to let you know, I'm aware that that is part of the assessment. We're going to check her cranial nerves, cranial nerve 8 for your acoustic, and we're going to do a whisper test. We're going to do it on one ear. So Ellie, I'm going to stand about 2 feet back. I'm going to whisper a word. You can look forward. I'm going to whisper 3 words, and I want you to repeat those words back to me. Are you ready?
Yeah. Dog, hog, jog.
Very good. This is going to make a noise. I'm going to put this on your forehead, and I want you to tell me if it's louder in one ear or the other, or if it's the same. Okay, are you ready? Okay.
It's the same.
It's the same, and that is a normal result. The other thing we're going to do is the Rhine test. We're going to go ahead, and I want you to tell me, this checks air conduction versus bone conduction. I want to know if A is louder or B. Okay, you ready?
A is louder.
A is louder. So that is a normal result too. Also with the whisper test, that is just a general screening for hearing acuity, and she did answer correctly. So her 3 tests are normal. High five. So Ellie, we're going to take a look at your mouth now. Is that okay? Smile. So she does have braces. Her lips are moving in symmetry when she's smiling and when she's speaking. They're pink. There's no lesions. There's no marks on them. And she also does not have an odor on her breath, which is good. And a new tongue depressor to take a look inside of your mouth. So if you wouldn't mind opening your mouth for me. Great. And I'm going to just kind of take a look. I'm just going to use this to kind of take a look at your sides of your mouth. Very good. Very good. Good. I want to say that when we're looking inside of her mouth, her gums, her mucosa, her lips are pink, they're smooth, they have moisture, and they are free from lesions. So also her teeth are straight, they're white with the braces. We're going to go ahead and look at your palate. You can see her uvula is moving up and down. I can see her hard palate, her soft palate. There is no lesions. I can see her glands at that second molar. They look good. Okay. Ellie, stick out your tongue. Lift your tongue up. Her frenulum's intact. Looking at the tongue, it was pink, also moist. Papilla is present. Her tonsils were normal size. They were not enlarged at all. There was no pus, no lesions, no discharge on them. They fit within the tonsillar fossa. When she was able to stick out her tongue, move her tongue around, that is part of the cranial nerve for your hypoglossal, which is 12. So I'm going to have you do that again. Stick out your tongue, move it side to side, move it up and down. Okay, and then I want you to press it against your cheek. Good. And she does have strength in her tongue. We already did cranial nerve 10, which is your vagus nerve, because when she opened up for me to inspect her palate, her uvula was able to move and she said ah. Cranial nerve number 9 right now, which is your glossopharyngeal one. So Ellie, I'm going to have you say ah, real big, ah. I know that made you gag, didn't it? Gag reflex, and I'm just surprising her with that because I know she would not want me to do that normally. So we're going to do your nose. So I'm going to have you take off your glasses again. And we're going to look, and like we said before, her nose is symmetrical. I'm going to feel the bridge of her nose. There's no lumps, no bumps, no bruises, mass, no anything there. So it is straight, it's symmetrical. So we're also going to, any tenderness, no pain at all when I touch it. It doesn't have any broken bones, there's no obvious deformity in her nose. I'm just gonna take a quick look at her nose. I'm not gonna put this all the way up, but just kind of look kind of quickly. See pretty far up with this. It's clear, it's pink, it's moist, and it's pretty straight, so it doesn't look like her septum's deviated at all. And have you hold one side of your nose and breathe in and out. Okay, and then hold the other side of your nose and breathe in and out. Okay, any problems?
No.
So the next thing I'm gonna have you shut your eyes. Okay, and we're gonna check your cranial nerve 1, which is your olfactory. I want you to hold one side of your nose. Okay, and then I'm gonna give you a smell, and let's see if you can smell it. Take a big smell. You know what it is?
Clementine.
I want you to go ahead and close your eyes and include the other side of your nose. And I want you to take a smell of this.
Coffee.
There you go, if that's okay. And we're gonna take a look at your neck. So we're gonna look at her neck, inspect her neck. There's no lumps, it's symmetrical, it's smooth, there's no lesions, there's no masses present here. I'm going to look up for any jugular vein distension, and I do not see any jugular vein distension, which is good because she's only 18. All right, Ellie, we're gonna feel your glands right now to make sure they're okay. So in front of the ear, before the ear is the preauricular, postauricular is behind the ear, occipital is behind the ear, behind the neck, the tonsillar or the jugulo-digastric, I'm not sure if that's right. I'm going down the jawline for the submandibular. Under her chin is submental. We're going to go down her neck for the superficial cervical chain. The deep cervical chain, she's going to have to turn her head. I'm going to have you turn your head to your right, and we're going to be feeling the air, but most of the time, according to the videos, you can't feel it. Okay, you can turn back. Your cervicular chain is down the neck, behind the muscles of her back. Supraclavicular is above your clavicle. And then the axillary is, you're going to go down the apex, and you're going to end up going down the chest wall. Her axillary, but this is her axillary area, so you're going to feel the lymph nodes down in here, but I am not going to actually go ahead and palpate all those underneath her arm. What I do is I want you to look forward, and we're going to look at her trachea. Her trachea is here, and we're going to palpate it, and her trachea is midline. There's no deviation noted. Can you swallow for me? I'm going to have you sit up just a little bit. We're going to check the range of motion in your neck, okay? Can I have you put your chin to your chest, please? Can I have you look toward the ceiling? Okay, can you put back, go ahead and look straight ahead. Can you look to your right? Okay, and turn your head and look to your left. Great, she has great range of motion. Check her thyroid gland. And swallow again for me. And the ability to swallow is cranial nerve 9 and cranial nerve 10. You can go ahead and sit back. Cranial nerve 5, which is trigeminal. And we're going to go here, and I want to open and close your mouth. Open your mouth, close your mouth. Open your mouth, close your mouth. Any pain?
Yeah.
There's no swelling, there's no clicking noted. And then I want you to go ahead and clench your teeth. Okay, clench your teeth. Okay. Now, I want to make sure that, I want you to clench your teeth and don't let me open your mouth. Very good. So we're unable to do that. Now, I want you to go ahead and we're going to check cranial nerve 8. I want you to puff out your cheeks. Smile and show me your teeth. Very good. Can you wrinkle your forehead? There you go. Squeeze your eyes shut. Okay, now squeeze your eyes shut and don't let me open your eyes. Very good. Go ahead and auscultate, since I do have this here. I want to go ahead and check her carotid vertebrae, and we're going to use our bell. And so Ellie, I'm going to have you look this direction. Okay, and then I'm going to have you look toward me. So there was nothing noted, so that is a normal finding. Listened for the bruit on her carotid. I'm also going to have you, I'm going to just have you sit there and I'm going to do